Hi, everyone. Thank you for joining us in this new episode of our People Power Health Insights interviews. Today, we have a very special guest. We got Dr. Ashley McClure with us. Thank you, Ashley, for joining us today.
My pleasure. Thank you for having me.
So let's start. One of the first questions that I ask our guests is, if you are walking into a room full of new people you haven't met before, how would you introduce yourself with them?
Um, any kind of room, any specifics?
In your room with new people.
Yeah. Well, I guess one strong thing that I resonate a lot with is where I'm from. So I'm from Seattle, the Pacific Northwest, which I think is why I'm so attached to enormous trees and forests and really have like a connection to nature from being from the Northwest. When I was little, I would play in a after school in a state park that had old growth like Doug fir and cedar trees. So that's a thing. I'm from Seattle, so that's my home. And then now something that's really important that I talk a lot about is being a mom. So my daughter just started kindergarten, and that's a huge part of my identity at this point. I've also been a primary care doctor for 12 years. And also now I call myself a medical community or a health community climate organizer. And a lot of people are like, what are you talking about? And then I go into, talking about my day job, but those are kind of the main things.
Amazing. Thank you. Thank you for that introduction. And okay, like our first question, usually for our guest speakers, is how did you get involved with health, with medicine? How did that came to be? Whether anyone in your family or some friend or you watch a TV show, how did you decide to go into medicine, Ashley?
Yeah. Um, so I think I don't know if I would have gone into medicine if it hadn't been for my grandpa. And I didn't really have my father figure role model was pretty distant from me, but my grandpa was an orthopedic surgeon. He went to, we both went to the University of Washington, although he graduated medical school in 1964 or something. So I think because in my family of all my role models, he was the person who was had the most meaning from his career. And we would literally be I would visit him in Kauai. He lived in Kauai for a while, in Hawaii, and people at the grocery store would be like, oh, Dr. Clifford, thanks so much, my arm, look, I fixed it, it's all healed up. And he just had this real connection to the community that was awesome, to have that role. And I think a lot of things I thought about, it just seemed kind of to be like pushing papers or not as directly connected to helping people. So I think it was seeing my grandpa and how his career really was meaningful, seeing that it was really helping people in a really direct way. And and then also that it was a really hard path, I think, was appealing to me. Have a very competitive side, and I think that, kind of choosing something that really required a lot of persistence, a lot of discipline had an appeal to that side of me too. Yeah.
I love how you talk about that connection with the community that your grandpa had, because I think that's one of the things that resonates a lot. First of all, with the best physicians that I have met and that I have knew in my life,
Mm.
but also with a lot of the work that we do at People Power Health, and that I know that you do nowadays. But we will get to that later. Is there any particular like story or event that you recall from medical school, Ashley? Maybe like a professor or a class or some project or some colleagues, anything that you think could like give us a slight overview of your experience in medical school.
Well, one so we had to do rotations. For medical school, I went to Oregon Health and Science University, in Portland, which was awesome. And we had to do rural rotations, which I think was a really wonderful thing. So I spent a month working with a family medicine physician in Eugene, Oregon, which is a small town. It's not actually the country, but I worked with the older physician who had had his own practice for 20 years or so. And I mean, I think really what the impression there again was just like, again, we would go to the grocery store and he would run into patients. And it was, I just really saw how important he was for a lot of different people. So yeah, just seeing how his role in the community there in a smaller town was kind of reiterated things. And I think that's part of why I went into primary care. I actually had the National Health Service Corps scholarship where I promised, my family didn't have any money to pay for med school for me, and I didn't either. So I got this amazing scholarship that everybody should know about. And I promised to work in primary care in an underserved area. And I think that really incentivized all the right things. And after that, because of that scholarship, I then, after residency, I moved to Washington, D.C., and I worked in a safety net clinic. And that's, was a really meaningful part of my work of working with mostly people from like El Salvador and Central America, and just really meaningful. I would have done Peace Corps if I hadn't been in medicine, but I didn't want to like add more time to my training. But I kind of did that, in a domestic sense. So
That's amazing. That's amazing. Thank you for that. Because again, talking about serving communities that are really in need is one of those common keywords that resonate and that come back again and again when we are doing these interviews for the newsletter. Now, let's start to move on a little bit from those first years into what you have been doing in recent years. So, as you mentioned, and as we mentioned earlier, one of the main topics that you have been working on is climate, right? So, how did that start? When did you start to realize how big the climate crisis is and the impact that it has on the health of populations?
Yeah. So after Washington, D.C., my husband and I moved to the Bay Area, and we live in Berkeley and I work in Oakland. And I became a mom in May of 2018, and I, on maternity leave with my daughter, on this exact phone I'm using right now, I just happened to watch on Amazon Prime the Inconvenient Truth sequel. I just happened upon it. Like I wasn't even looking for it. And I watched it with her at home. And I just had, having a little bit of space from work and training, I had this like wake up moment, because I had thought, and I'd been so busy being a doctor, like working really hard to learn how to do that and doing that. And I just had this wake up sense that this little tiny human whose safety was now more important than my own to me, that the way we're headed of burning coal, oil, and gas is incompatible with her safety or any child's safety, any person's safety. So it was becoming a mom, and all of a sudden, 2030 was like my daughter's 12. That's like 6th grade. 2050, that's like she's, got her own family getting started. Like it made those future dates that we all read about in climate, scenarios, it made them like visceral and personal in this different way. And then that November, the Paradise Fire, was the fire of that year. It was like another mega fire in California that killed a lot of people, was devastating. And that's when I started learning about air quality indices and what is the AQI and why is this dangerous and why do I need an air purifier? So I was on maternity leave still as the last month, and I started learning about that and like how dangerous it is for infants' lungs. But then, I would, for about 2 weeks that November, it wasn't safe to go outside for her because of the smoke. And then I started watching, like looking at the air quality indices of China and India and the Middle East, and theirs were worse, but it wasn't because of fires. It was because of coal plants, and it was because of industry, and this was the way, this was their air quality standard, which was shocking. And so I really, because of those fires and becoming a mom, I just had this wake up that like being a doctor is not enough, like I had this sense before that before becoming for me a mom, that somebody's watching the house, like if this is such a disaster, like there's real experts that are going to fix this. But I realized that year that they know what's wrong, but they don't have the political power to fix it. And we all actually need to be a part of fixing it, just like they did with civil rights. And I just reoriented, like it had to become the center of my life to be like a mom I could sleep, who could sleep at night. So the second day back from my maternity leave, that it was December 4th, I showed up to give grand rounds. I didn't know what I was talking about, but I started talking about the health impacts of climate change. And my mom showed up with my daughter, and I nursed her afterwards. And I just haven't stopped talking about climate as a health crisis ever since. And I guess the last thing I'll say is, because, I started going also to like citizens climate lobby meetings and, different groups that are already working on climate. But I realized that to not leverage the fact that I'm a physician was not using my tools as well as I could. And so the kind of unique voices of health professionals, as committed our whole lives to looking out for people's safety and the trust that brings, I realized that was really what I have to offer the movement, is using that in the interest of advancing solutions. So that's why I ended up co-founding Climate Health Now, which is really, trying to bring the health community into the climate movement here in California.
Amazing, Ashley. Thank you for that, because I am sure that a lot of people that will be watching this video will start to realize and understand that climate change and the climate crisis is not something that is restricted to one city or one state or one region. Rather, it's something that it's all across the globe, and that more importantly will affect not only our lifetime, but also the lifetime of children, of our kids. So I fully understand and hear you when you say that in order to be able to go to sleep at night, you need to know that you are doing something for these babies, kids, children. Now, and tell us a little bit more about what climate health is and what you have been doing in the organization in the last year.
Yeah. So Climate Health Now, we're a state level community organizing group. And so we, in California, anybody who's in the health community is invited to be a member. And that includes, from public health to emergency room nurses and therapists and dentists and phlebotomists, like the whole health community. And we are organizing that community to be a really strong advocate for policy level solutions that are equitable. And what we're doing is really helping, because a lot of people in health have the sense of like that we're not supposed to be political. It's kind of trained into us that you should, we stay out of politics. But the fact that health is inherently political kind of requires us to take a seat at the table. So we don't need to be partisan at all, but politics have enormous impacts on health, much more than our clinical care, by the way, right? So, for instance, what we've been working on recently is our 2 bills we've been getting our members to speak in support of, and to speak to their legislators in support of, to pass. So one of those is about transitioning so that California schools can no longer buy diesel school buses in 20, going forward, that as school buses have to get replaced, that they only get replaced with zero emission buses. I actually, when I'm bicycling around town with my daughter, I tear up when I see electric school buses, because it's just like, that's positive change. That's the way it should be, because no kids should be inhaling diesel fumes every day. And then the other one we've been working on, which actually is really relevant right now, because in the Bay Area right now, we're all, inhaling the smoke from the fires up north, like close to the Oregon border. And schools have kind of been scrambling, like, what do? We got to cancel recess, or I don't know, turn on the air purifiers. Like, we need our schools to be ready to and resilient in the face of climate impacts. So the other bill we've been working on is creating a statewide master plan to get public schools to be climate resilient, to to decarbonize our schools. So we've been getting our members to speak to their state elected officials to say, like, please pass this in the interest of health. Like, this is something that we need to do. And it's been amazing. I think so many of our members, after they first meet with their state senator, like, that was crazy. I can't believe we did that. But it's really invigorating. And, there's not a lot of venues where an anesthesiologist is going to be on a meeting with like a school nurse, and so the kind of community and connections that we foster through this advocacy for on our shared values, it's a really unique space. And I think a lot of people really find it really meaningful. There's a lot of burnout in the health sector now, probably more than ever. And even though this is more work, I think a lot of people really find it meaningful to give their time to. So that's some examples of what we've been doing.
No. Thank you for sharing those. And as you said, finding those shared values with other people in our communities, that's a very powerful moment, because that's the moment that the change starts to happen, and that people start to realize the power that they have working together.
Yeah.
Now, just one more question related to this before we move to the wrap up and closing the interview. There has been a lot of conversation in the last few days about the climate action week, right?
Mm-hmm.
I think several cities and especially I think New York, there's some conversation going around it. Could you share a little bit about that with us?
Yeah, I know that in Sacramento there was a big action with a lot of groups, calling on Governor Newsom, for instance, to phase out oil and gas, because so there was a big event this past Sunday, and actually in Climate Week also this week was announced that Governor Newsom, along with California's Attorney General Bonta, is suing a handful of large oil companies for misinformation, basically, and the harm that they are causing through that misinformation. So there's a lot of buzz around Climate Week, and a lot of legislation that is sitting on the governor's desk right now is related to climate. And so there's kind of him talking about what he's going to sign that's been then given to him. So yeah, I think it's a big rallying time. And actually, this week actually marks the 4th year anniversary of Climate Health Now, because we started just before COVID. There was a youth climate strike September of 2019, and there was a huge march in San Francisco. So I think this week is really kind of turning a lot of people's attention to climate, which couldn't be more needed.
Yes.
Yeah.
Here in New York, there's also a lot of buzz and chat about it. So I can only imagine. And then congratulations on the 4th anniversary.
Thank you.
Okay, so when we are starting to wrap up our conversations, I usually ask a couple of like fast, short questions, and I will just like listen to the short answers that our guests gave. So, is there any figure, person, dead or alive, that you would love to meet with and grab like a cup of coffee or a cup of tea or something to have a conversation?
I mean,
Anyway.
ooh, yeah. Thich Nhat Hanh, Gandhi for sure, and probably MLK. I would love to get some advice on strategy from the three of them.
Okay, amazing.
Yeah.
Another question: is there any like movie or documentary or song or some kind of media that you would recommend people to watch, to listen to, or a podcast or something?
Yeah. Yeah, lots of ideas. There's one that I listen to every week. This is more for like personal resilience reasons, but Tara Brach is a meditation teacher and therapist and Buddhist leader who talks about kind of emotional health and resilience in these insane times. So she's really helpful to me. It's funny, yesterday I was at the park and somebody, for the first time ever, I was in a documentary called The Week, and somebody at the park said, "Were you in that movie?" And I was like, "Oh my God." So it's an interesting thing, and I think it's an interesting model. So this group, they made this documentary called The Week, and it's meant to be watched in community, and there's 3 sections, and the idea is that you watch them all, and that one's about like the climate science and how bad it is, one's about what people are doing, and then where to go. So that would be maybe an interesting one. And I listen to, in terms of music, I listen to a lot of Pete Seeger. The sense of solidarity
Okay.
that people sang about then, I think still really feels relevant and helpful.
Amazing, thank you. And well, is there any final message, any final idea that you would like to share with our viewers?
Yeah, I think, well, first, a very clear invitation for anybody who lives in California, who's part of the health community. We would really love you to join Climate Health Now. Our website is just climatehealthnow.org. And I think the broader point would be that, climate is a collective problem that really needs us to work together. And so usually that means joining an organization. And there's so many great organizations, but I think finding the one where you feel like you can use what skills you have to bring to the greatest degree is really the thing to do. This is, really something to solve in community. So finding your people to work with has really been the key for me.
Amazing. Thank you very much, Ashley, for joining us today. And thank you, everyone, every one of our followers, our viewers, for watching this interview. Please share it with other people so that others can learn more about the impact that climate has on our daily lives. Thank you, Ashley.
Yeah, thank you. Thank you for having me. Take care.